Good day, everyone. Welcome back to my channel. Today we'll be talking about sudden loss of period and its causes. Now, this condition is known as amenorrhea, and it is the absence of a period or absence of menstruation. Now, let's talk about the cause of this condition called amenorrhea. There are two causes. There are two types. First of all, there is the primary amenorrhea and the secondary amenorrhea. The primary amenorrhea is when a girl of 16 to 17 years has not yet seen her period. Now, the secondary amenorrhea is a condition whereby a girl who is already seeing her period suddenly stops seeing her period. Now, the most common cause is pregnancy, breastfeeding, and menopause. We want to talk about other causes except these three causes. Now, the first cause is hormonal imbalance. Fluctuations in hormones, particularly the estrogen and progesterone, can disrupt the menstrual cycle. This can be due to conditions like polycystic ovary syndrome, which we talked about last time. PCOS can be a cause of amenorrhea. Now we have the second cause, which is stress. Both psychological and physical stress can interfere with hormones that regulate periods. So it's better to manage your stress, like we talked last time. Know how to manage your stress so it won't lead to amenorrhea. Now the third cause is weight changes. Sudden weight loss or weight gain as well as excessive exercise can have an impact in the menstrual cycle. So it's better to exercise. It's good to exercise because excessive exercise is not good for the body, and it can also lead to condition known as amenorrhea as we're talking about. Now, the fourth cause can be medications. Certain medications such as the birth control pills, antidepressants, antipsychotic drugs can cause sudden loss of period. Now, the fifth cause are underlying medical conditions. Chronic illnesses like diabetes, obesity, thyroid disorders, kidney diseases, and certain autoimmune disorders can lead to missed periods. Also, a condition known as the Asherman syndrome can cause amenorrhea. This is a rare genetic condition where scar tissues form inside the uterus. So this can lead to amenorrhea. Also, high level of prolactin in the body, in the blood, can also lead to amenorrhea. Now, the sixth cause is known as is chemotherapy and radiation therapy for cancer. When someone undergoing chemotherapy or radiation therapy for cancer can also have amenorrhea because it can be a side effect of the chemotherapy and radiation therapy. Now, the seventh cause can be previous uterine surgery such as dilation and curettage. So someone who has undergone a previous surgical procedure like dilation and curettage, which is known as D and C, can also have amenorrhea. Now let's talk about the complications of this condition known as amenorrhea. Now the first complication is osteoporosis or cardiovascular disease due to lack of estrogen. So when the body lacks estrogen, it can lead to osteoporosis or cardiovascular disease. And the second complication is difficulty getting pregnant or infertility. Now, someone who hasn't seen a period for a long time can have difficulty in getting pregnant, or it can also lead to infertility. So it's better you treat it properly and treat it early to avoid it getting to this level. Now, the third complication is pelvic pain. When someone that has amenorrhea is also likely to have pains in the pelvis. Now let's talk about tests you should run when you've not seen your period for a very long time. You've not seen your period for like 3 months or more. These are tests you should run. The first test is pregnancy test to confirm if you're pregnant or not. So when you've not seen your period for some time, it's okay for you to go for pregnancy test. The second test is blood test. This test is to check your hormone levels and detect thyroid or adrenal gland disorders. Now the third test is the genetic testing. We also have MRI. That is if your provider suspects a problem with your pituitary gland, the provider should make sure you do an MRI. Now the fifth test you should do is ultrasound. If your provider suspects issues with your ovaries or uterus, so you can do an ultrasound to check what actually the problem is.